This medication is used to help preserve kidney function and manage kidney damage and other problems in people with an inherited disorder that causes buildup of a certain natural substance, cystine, in the body, also known as nephropathic cystinosis. Cystine buildup can cause problems such as kidney issues, slow growth, weak bones, and eye problems. Cysteamine helps the body get rid of cystine, which can help alleviate these symptoms. It is important to take this medication as directed by your doctor, usually on a daily basis. The capsules are designed to be sprinkled onto certain soft foods, such as applesauce or yogurt, and should be taken at the same time each day. Be sure to follow the specific dosing instructions provided by your healthcare provider. Before you start taking cysteamine, make sure to read the patient information leaflet and instructions for use provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. Typically, you'll take this medication by mouth twice a day, spaced 12 hours apart. It's important to take it on an empty stomach, at least 2 hours after and 30 minutes before eating. If you can't take it without food, you can have a small amount of food, 4 ounces or half a cup, between 1 hour before and 1 hour after taking the medication. Stick to one method, either with or without food, for each dose, and avoid high-fat foods around the time you take your cysteamine. Swallow the capsules whole with fruit juice or water, but not grapefruit juice. Don't crush or chew the capsules, and avoid alcohol while taking this medication. If you can't swallow the capsule whole, you can sprinkle the contents on 4 ounces of applesauce or berry jelly and eat it within 30 minutes, or mix it into 4 ounces of fruit juice, except for grapefruit juice, and drink it within 30 minutes. Don't save the mixture for later use. The dosage will be based on your weight, medical condition, and how you respond to treatment. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. It's important to take this medication regularly and at the same times each day to get the most benefit from it. Possible side effects of cysteamine bitartrate capsule, delayed release sprinkle include nausea, vomiting, stomach/abdominal pain, fever, loss of appetite, breath/skin odor, tiredness, drowsiness, dizziness, and diarrhea. If any of these effects persist or worsen, consult your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. Notify your doctor immediately if you experience any serious side effects, such as mental/mood changes, deep sleep, unusual tiredness, headache, hearing problems, eye/vision problems, skin problems, bone problems, seizures, severe/bloody diarrhea, signs of bleeding or ulcers in the stomach/intestines, or a rash. Seek medical help right away if you develop any rash, or if you notice symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects, so if you notice any other effects, contact your doctor or pharmacist. Remember, in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking cysteamine, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to let them know about any medical history, especially if you or your child have liver disease, stomach/intestine problems, or a low white blood cell count. This medication may cause dizziness or drowsiness, and using alcohol or marijuana can intensify these effects. It's important to avoid driving or using machinery until you can do so safely. It's also important to discuss the use of marijuana with your doctor. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using. If you are pregnant, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It is also unknown if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. When taking cysteamine bitartrate capsule, delayed release sprinkle, it's important to be aware of potential drug interactions. Other medications or products containing bicarbonate or carbonate may decrease the effectiveness of this medication if taken at the same time. It's recommended to separate the time you take a dose of cysteamine delayed release by at least 1 hour before or after any products containing bicarbonate or carbonate. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist, and never change the dosage of any medicines without your doctor's approval. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. It's important not to share this medication with anyone else. Your doctor may also require you to undergo certain lab or medical tests while taking this medication, such as checking your cystine or cysteamine levels, complete blood count, and kidney/liver function. Make sure to keep all your medical and lab appointments, and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's less than 4 hours before your next dose, then skip the missed dose. Take your next dose at the usual time. Do not take double the dose to make up for the missed one. When it comes to storing cysteamine bitartrate capsule, delayed release sprinkle, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in its original container and avoid removing the desiccant. Keep the bottle tightly closed and out of reach of children and pets. And when it comes to getting rid of any leftover medication, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. If you're unsure about the best way to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.